Autism is a developmental disorder that affects communication and behavior. It impacts the nervous system. Autism also causes impaired social interaction, indifferent attitude towards all the aspects of normal life. Some symptoms of autism includes abnormal body posture or facial expressions, abnormal tone of voice, and avoidance of eye contact. More symptoms of autism, unfortunately, include extreme sensitivity, lower IQ, and repetitive behavior. Treatments for autism include applied behavior analysis, early start Denver model, floor time, and occupational therapy. Medical and mental issues that come with having autism include epilepsy, sleep disturbance, anxiety, and depression. The prognosis for autism is highly correlated with their IQ. Low-functioning patients may never live independently. They typically need home or residential care for the rest of their lives. And as for high-functioning patients, they may live independently, hold jobs successfully, and even have family of their own. Medication that is typically used for autism patients includes antipsychotic. It reduces or improves the symptoms of certain psychiatric conditions. People with autism often seek specialists. Some may be speech therapists, occupational therapists, and clinical psychologists. Calming someone down with autism might be difficult, but it is not impossible. There's a few things that you may be able to do to help them calm down and seek peace. There are a couple of things you may be able to do to help comfort people with autism. Some may be giving them some time, talking to them calmly but patient, and giving them some space. Three main symptoms of autism include repetitive behaviors like hand flapping, rocking, jumping, or twirling, constant moving, and hyper behavior. There are 3 levels of autism. These 3 levels are ASD level 1, ASD level 2, and ASD level 3. These levels are based on a person's strength and limitations that come with the ability to communicate, adapt to new situations, expand beyond restricted interests, and manage daily life. Level 1 of autism is a patient who is in need of little support, and a level 3 patient needs a deeper amount of support. These 3 levels of autism can be useful for understanding how low or high functioning a person with autism is. Besides the levels of autism, there are different types of autism, which are autistic, Asperger's syndrome, and persuasive developmental disorder. Autistic disorder, sometimes called classic autism, usually has significant language delays, social and communication challenges, and unusual behaviors and interests. Some patients with autistic disorder sometimes even suffer from intellectual disability. Asperger's syndrome usually has mild symptoms of autistic disorder. They might have social changes and unusual behaviors and interests. However, most of them do not have issues with language or intellectual disability. Persuasive developmental disorder is sometimes called atypical autism. These individuals meet some of the criteria for autistic disorder, but not all. Researchers still aren't completely sure what genes are responsible for autism. Many believe that the causes are genetic and influence the formation of critical areas of the brain and the distribution of gray matter. Autism risk factors appear to include such influences as parental age at conception, maternal nutrition, infection during pregnancy, and prematurity. The most common single and chromosomal disorders associated with autism include Angelman syndrome, chromosome 15 duplication syndrome, tuberous sclerosis, and Fragile X syndrome. There is not one true cause of autism. It is suggested that autism develops from a combination of genetic and non-genetic or environmental influences. The number of children diagnosed with autism spectrum disorder is rising. Autism affects children of all races and nationalities, but there are still factors that may increase a children's risk. Risk factors include your child's sex, family history, parents' age, extremely preterm babies, and other disorders like having a Fragile X syndrome. Complications include problems in school and with successful learning, employment problems, inability to live independently, social isolation, and stress within family.